Good afternoon, everybody. Welcome. We're going to get going here in just 1 second. Bear with me. And today, very happy to have the opportunity to speak to a large group again, and we're excited to be able to share a variety of updates that have happened over the last couple of weeks. And what we're going to focus on today is going to be everything from the CDC updates, the swim lessons, and a lot of other topics that we haven't been able to address too much in depth yet. Today we have very excited to have the founder of StarGuard and the head of Starfish Aquatics, Jill White, with us. We also have Dr. Justin Sempsrott is back with us again, and Justin's going to speak to his specialties. And we also have our newest promotion, Joel Riker, Vice President of Operations for StarGuard. So I'm going to take them off screen and going to talk and bring the presentation back up. Hang on 1 second here. So today we're going to address a bunch of things that have occurred over the last couple of weeks, and more importantly, we're going to get into some of the details of the CDC guidance. Just some quick housekeeping. The meeting is intended for informational purposes only. This is the guidance and medical direction that is provided is specific to StarGuard Elite clients. If you are joining us from another facility, please always follow your guidance. Oops, pardon me. Follow your guidance and your agency's guidelines. The meeting will be recorded and available for the StarGuard Facebook page. We'll have a question and answer session afterwards. Information is designed to be general in nature. Specific application will vary. The information continues to be updated frequently, which is why we are hosting today, because there has been a lot of updates since our last one. And today's information is intended to address new developments and builds upon the previous presentations and informational releases. If you had joined us in April 30th, that video from that presentation and let me see if I can. So that information is available, both the presentation and the video, on YouTube and on our website. You can download it there and see that. Today, you will see that we will do a variety of informational updates that build upon what was discussed there. So today's agenda, specifically, we're going to talk about developments since April 30th. We're going to get into the CDC Aquatic Operations Guidance. We're going to provide some additional medical director updates. Jill White is going to present on swim lessons and programming and best practices and how to navigate that. That's a common question that we've had a lot of questions for. Excited to be able to provide some answers. Joel Riker is going to speak to some training and recruiting procedures and best practices. And then afterwards, we're going to answer questions. So let's quickly like to bring up the timeline and talk about the evolution of the development throughout this whole process. We're 10 weeks in since the first memo came out. It's hard to believe in some ways that everything has happened to this point, but we have had quite a bit of progress and continue to. So since the early mid-March days when we were planning, and then at that point we ceased training, we've seen quite a bit of updates over that time. Most notably, in the last 2 weeks, we released our first version of our COVID-19 operations document on 2 weeks ago. Version 1.0 came out. Later that week, IAPA and WWA released guidance and considerations. And then additionally, last week, the PHTA released a document, all of which are very useful and have a lot of great information that if you have not seen it, we highly encourage you to see it. I'll pull up some links to access that in just a second. And then a big update was last Saturday when the CDC guidance, CDC considerations were released. And that is what we're going to address today. So yesterday, we put out version 2.0 of our document, largely based on some of the developments with the CDC guidance, as well as what's come out through the other industry organizations. So for the updated guidance, the CDC's considerations, we're going to talk about that. IAPA, for those of you that are not in amusement parks and attractions, this may be an organization you're not familiar with. However, on IAPA's website, there is I believe it's a 36-page document, and it addresses all sorts of areas of attractions, everything from from theme parks and water parks to smaller attractions. But there's a lot of best practices that apply universally throughout any type of attraction or operation. So please check that out. World Water Park Association put out a long considerations. It's an 8-page document, and it has a lot of great information in it. And then the Pool and Hot Tub Alliance as well on the PHTACoronaupdate.com website has a variety of resources that can be useful. A lot of them are saying very similar stuff from organization to organization. But that being said, there is definitely good takeaways from all of it. And then lastly, we know that a lot of state and regulatory guidance is coming out, and this is where we can't emphasize enough the importance to be following and adhering to your local states. We know that some states we already have training happening versus others they're still very far off, and that's it's always important that you're following your local guidance in that regard. So for the CDC aquatic updates, I'm going to bring Justin on here. All right, Justin.
All right, thank you very much, Wes, and thank you guys all for being here. I think the most striking thing for me was when you said that we started doing this 10 weeks ago, because it feels like we've been at this for years. This is simultaneously the fastest and longest 10 weeks I think that the industry has seen in quite some time. And again, want to start my message with the emphasis that there are a lot of people dying. There are a lot of persons of color and low socioeconomic status who are disproportionately affected like this. And we are still in the active phase of an ongoing public health crisis. Some areas of the country are more affected than others. And this should be viewed through the context of what's going on in your local area, because some places are nowhere near ready to even consider opening, and other places are moving towards that within the next couple of weeks. And there's going to be some appropriate level of dissonance between regions. And as we move forward and relax the physical distancing guidelines and shelter-in-place orders within your areas, you might see localized outbreaks. And then the response will be that we'll have smaller areas that become quarantined and smaller areas that become isolated instead of large groups. So since last time we spoke, some of the questions that came up and really presented some logistic challenges revolved around temperature checks, and coming to learn that that's considered a medical exam with different regulatory and human resources requirements. And so instead of making that a requirement, we made it a suggestion if practically feasible within your area. We know that there's a lot of asymptomatic spread, and that by the time somebody has a fever, it's often later in the illness, and we aren't as making as strong of a recommendation for that. And the CDC guidelines for aquatics facilities, I think, are absolutely remarkable. Dr. Tessa Clemens and the rest of her team really did a great job, and it reinforces a lot of the messages that we've been emphasizing, which is prevention is going to be more important than treatment. And that's if you're reducing the number of people in the facility, limiting the number of people within certain parts within your facility, enhanced cleaning, and really a lot of those social engineering factors, more so than the actual resuscitation. And they, again, emphasize the importance of everyone wearing face coverings. I know that some of the other lifeguard training agencies have been waiting on these CDC guidelines to come out, and I've been working with some of them as well. And I anticipate their guidelines should be coming out within the coming week or so. And we'll also emphasize the importance of wearing face masks, even for lifeguards on the stand. And I want to just highlight two really important things from the CDC guidance. One, that under their section of gatherings, We want to avoid group events, gatherings, or meetings both in and out of the water if social distancing of at least 6 feet between people who don't live together cannot be maintained. That is what we've been saying for a while, but this next part is what I think the industry really needs to hear. Exceptions to social distancing guidance include anyone rescuing a distressed swimmer, providing first aid, or performing CPR with or without an AED. Aquatics has always been about risk management and risk mitigation. Opening a facility, the risk is not going to be zero for drowning or for the spread of coronavirus. And so it's about managing the levels of risk. If we've pre-screened everybody at the gate, we're cleaning, we're making sure that people aren't aggregating in large groups. We've done a lot of the risk mitigation, but we still need to perform contact rescues. We still need to train with those contact rescues. We still need to provide first aid. And if we can do it from 6 feet away, great. But if not, then the guards and the medical responders at your facility should be empowered to get in and perform those. And I think that the CDC guidelines really emphasize that well. And then the other thing that I wish that I had thought of that they did a phenomenal job with is designating a COVID-19 point of contact at your facility. And it can be a manager, it can be the GM, or it can be a lifeguard supervisor that's on duty. But any staff, any patrons that have a COVID-related question can be referred to that one person, and you get clear messaging that's coming from one source who then has access to their client partner, to the medical director, to answer those additional questions and preventing multiple conflicting messages from getting out. And so I think that appointing that COVID-19 point of contact or champion at the facility is really important. And then the outside of this portion of the CDC document, they just updated their return to work guidelines. It was 7 days from onset of symptoms, and now it's 10 days to show that, again, we do know that there's a longer asymptomatic spread period afterwards. And then it's really important to emphasize that the lifeguards who are responsible for watching the water should not be monitoring distancing. They shouldn't be enforcing use of masks or anything except those activities directly related to drowning prevention. So that's all I've got for you guys until we get to the Q&A. I'm seeing some start to pop up, but I will turn it back over to Wes. Thank you, guys.
Excellent. Thank you, Justin. And in regards to these guidelines, these QR codes throughout will hopefully help you get to it. If you do not have the link for that, this information will be available on our Facebook page, and we will post it on YouTube along with this presentation afterwards, because I know that that's a common question. So please keep that in mind. All right, we're going to move forward just a little bit. Speaking of the CDC guideline updates, this is the updated table of contents from our document. The document that we put out, version 1.0, was focused. It was about 1.5 pages, and we're about 2 pages in table of contents. The content is growing. There is changes. Largely, the updates have been very minimal or provided further clarifications. But that being said, for existing clients, as you're updating, as you're keeping up to date on all of the guidance, please make sure you're going in and checking the latest document that's available, so that we're not getting any situations of inconsistent information. There is a change log that's been added so that you can see what was made, what changes were made every update. The big changes in 2.0 are adding the COVID point of contact, putting more information around ventilations, and then adding some of the other smaller clarification areas that have come out through some of the other guidance. All right, so I'm going to, bear with me, I'm going to bring up Jill. Sorry, my mouse is acting up here. Jill, can you hear us?
I can. Can you hear me?
Okay. Yeah, excellent. All right. So I'm going to have you on. Bear with me. Oh, gosh. Sorry, having a small technical issue here. Trying it this time with 4 people. It's taking a little bit longer. I don't know why the captions are showing, but I'm gonna have to bear with it right now. And Jill, I'm gonna have you go, and I'll get the captions figured out.
Sure.
Sorry for that. All right, Jill, if you're ready, you can go.
Okay, go ahead and move to the next slide. So just like Justin has said, a lot of what relates to swim lessons or to your actual facility reopening with lifeguarding, with general operations is the same for swim lessons. And the guidance is continually evolving. We're not going to have a prescriptive one size fits all, here's what you do for swim lessons guidance. There's just too much variability between what you're needing to do at your facility. And so as in general operations, your local authority having jurisdiction takes precedence. There will likely be phases of easing or tightening restrictions, as Justin mentioned, and the biggest factors of what you are able to do is going to depend on your facility size, how many instructors you have, the swim lesson programs you offer for the various ages or stages, and also, as Justin mentioned, there are really no guarantees that any of what we do related to best practices will prevent exposure. All we can do is do the best we can with what we've got. So there are a couple of different approaches that you can take related to what you're doing with your program. Next slide, please, Wes. So you can modify your existing program basically by reducing your numbers, figuring out methods to modify how you teach, how you distance, how you set up your program, or you've got a really unique opportunity to create something new for this season and create something that has these modifications built in, but maybe completely different than you've ever thought of doing for your Learn to Swim program before. And to me, that's what it really excites me, that we've got this opportunity to even make our lessons better. They may be completely different. They will be completely different, but they can be better. So let's talk about some of the existing programs that you're going to modify. So you need to look at 3 areas. 1, the contact with each other, the contact with the instructor, then contact with the surfaces, all of the toys and the teaching aids and the equipment that we use in swim lesson programs that you might not if you just open up your pool to lap swimming. And then your staff training and patron education. And in just a second, I'll go into a little bit more detail on those. But with regard to creating these new programs, there's some really cool things that you could do with things that build in that social distancing, like setting up stations. So I'm sure you're familiar with something like a fitness trail where you go to a certain place and they have 10 or 12 different stations. Everybody is kind of evolving and moving through those stations at their own pace. You know, we could think about taking your swim curriculum, whatever program you use, and chunking that into little self-contained, self-directed teaching models and setting that up with a combination of things that are in the water, on the deck, so that as your people come into your lesson, whatever that is, for that particular time, they all stay self-distanced and self-directed as they move through the learning activities. You can set them up so they're completely self-directed or even instructor-led from on the deck at these individual stations. You might also want to think about, instead of having your lessons that are open to anyone to come in to form your lesson cohort, to instead have household groups come in and set up that type of registration, and then consider blended learning, where you actually have practice times where certain groups can come in during that time after they have watched things online, and then maybe some follow-up with some other online learning outside of the time when they can come to the pool, since that will probably be very restricted. Okay, next slide. So getting into the people-to-people contact, I just want to briefly go over some of the types of things that you might need to do and consider specific to swim lessons. So if you figure staying 6 feet away, that radius gives you 113 square feet. So your health guidance may come down to what your volume of people in your pool is based on your bathing load. For swim lessons, you may need to look at it a little bit different and figure your square foot area that you have to teach in, or that it's practical to run your lessons. Divide that by 113 and use that maybe as a means to kind of determine within various programs, what can your maximum capacity be. Then you need to reduce or eliminate some of these common areas. You know, specifically, typically you would have a viewing area where parents would come in and watch, or where groups of people are waiting as your lesson programs are staging to go into the water, to the pool area, or coming back out. You need to eliminate those types of areas as much as possible, and look at how you flow people in and out. Ideally, one entrance, everybody comes in, enters the building from one place and exits at another place. If you have that capability, you might not. And then if you do have an exit area, you need to make sure that you monitor that, because that may be a place where people could have access. If they go out and that door remains open, someone could come back in through that same door. And we don't want to have that unintended consequence of an access point that you don't have surveillance for. So you need to consider that. You also want to make sure that you reduce the use of the changing areas, and again, getting back to those group congregations as much as possible. But you need to be very careful about this, because in some jurisdictions, we're seeing a facility being allowed to open, but showers not being allowed to be used. Other areas are saying, if you're going to open up your facility and you're going to get a permit for the season, you have to operate with all of the things that are normally required by your health department or your authority having jurisdiction, such as having access to so many showers per patrons or so many bathroom areas. So make sure that if you're going to be making that kind of adjustment, that you have looked for a variance or checked with your AHJ on that. Okay, the swim instructors wearing face coverings. This has been a question that we've had quite a bit, and some of the guidance says you don't wear swim coverings in the water, and that is true. So anyone who is immersing their face in the water, which would be your students, or swimming, they should not be wearing face coverings. But anyone who is keeping their upper body or their face out of the water still needs to wear those face coverings, just as if they were on deck. So staying above that water surface, having that ability to minimize that disease transmission by using the coverings. And the breath control drills and activities that we've always done about, how to hold your breath and how to exhale, and all of those kinds of things that are built into our curricula need to be eliminated, with breath control only into the water, not above the water. When possible, keeping the instructor to the side of the students, not face to face, and limiting body contact. So in the Starfish swimming curriculum, the use of a rescue tube is already built into that. So for those of you who use that program, not a whole lot of modifications you'll need to use. But if you haven't before, you may want to consider having a rescue tube or some other type of equipment where, rather than students swimming out to the instructor making body-to-body contact, the rescue tube or a device is held out away from the instructor. The student swims to that, moves around, and goes back to the wall. Also consider using things like the confident swim vests, because the idea here is to have minimal contact with the instructor. So if the instructor at various levels is having to hold up students, by using some type of a flotation vest that doesn't impede the swimming body position or being able to move the arms appropriately, the confidence vest can add that little bit of flotation that will help reduce some of that body contact. Okay, next slide, Wes, please. And the the surface and equipment contact disinfection, a lot of these same practices will be what you're doing for all of your other equipment at the facility, but making sure that you have a contactless check-in, so everybody's not sharing the same pen when they sign in for lessons, that your rosters are kept electronically or in some way that people don't have to congregate to do that and or touch anything. Consider having students bring their own equipment if they can, or maybe even check out equipment for a certain session if that's possible. But what we want to avoid is that sharing of stuff, so having a whole bunch of toys at the end of the lane or in your swim lesson area and having everybody just kind of grab from the pile. We need to eliminate that. Disinfecting equipment between use as much as possible. Try to have the patrons do that. But if your staff is having to do that cleaning, make sure that you separate what's clean and what's dirty. So maybe keeping some bins that you can separate those things, or consider keeping equipment in the water, whether it's in mesh bags or floating bins, so that the water is serving as that cleansing and disinfectant as you go through your day. Next slide. So for training, I'm sure some of you are already down this path with training and have taken advantage of some of the blended learning options for your staff so that you can do all the knowledge stuff ahead of time, and then getting into the actual training you need to do, the COVID-19 education, your specific policies and how you've modified your program, and in particular, how to put on and take off those face coverings, along with any other guidance from your AHJ that needs to be included in your operations. And then for patrons, making sure that you have very clearly identified what are the expectations for their behavior and what are you doing to help enhance the reduced risk for exposure during your programs. Next. So there are a couple of resources that you can request that will put out a little bit more detail than we've had time for in this presentation today. But for those of you who want that COVID-19 for aquatic professionals training as part of your staff orientation, Starfish Aquatics Institute has created a course that is online. It's available free to anyone. It comes with an in-service certificate at the end that you can use to prove that your staff has taken COVID-19 training. It contains information about COVID-19 generally, and then specific things for aquatic professionals, and it's updated frequently. So that can be a great resource for you. The link down there is at the bottom. And then Starfish Aquatics Institute is releasing a white paper regarding social distancing and operational support for swim lessons. We have an updated version that will incorporate some of the new CDC guidance that will be available on Friday. So both of those things, along with if you would be interested in finding out more about the Starfish swimming program and how that curriculum may work for you well this season, you can go to either of those links. Okay, so Wes, I will turn it back to you and come back with answering questions as we get to that point.
Excellent. Thank you, Jill. All right, we're going to transition and bring Joel Riker online. And let me get the system set up here. I apologize for these technical difficulties. It's not always easiest. All right, so Joel's going to discuss some training and hiring. Let me get this set up. All right, Joel, it's all you, buddy.
All right, great. Thanks, Wes. Yeah, I was going to discuss hiring and training. It seems like we've been talking about hiring and training virtually since March now. We've released a lot of information when it comes to the virtual hiring, virtual training, So really what I want to do is just, talk about best practices and review some of the things that we've discussed in our memos. So with people starting to open or get ready, just kind of a reminder of these are some of the things you can do to move forward and try to limit some of the face-to-face things. Wes, you want to go to the next one? Great. So virtual interviews they're a great way to help reduce traditional in-person contact and really still get your long list of interviewees done. SGE has been doing virtual interviews now for a while, and it's been very successful. I've conducted several hundred, I assume by now, in virtual manager interviews for larger clients, and we've also done all of our contractor hiring this way as well. So I really strongly encourage clients to embrace this if you're not doing so. Some of the platforms that you can use, social media, Facebook, Twitter, Instagram, those are all great ways. Creating some sort of promo video to put on YouTube. I like the idea of the podcast. I read about podcasts and hiring. It's a great way to do job fairs that you can't typically do during this time of year. So having, the managers of certain departments go on and explain, the hiring, what do we do, and try to get applicants that way. And then once you've got all your applications, you can do your FaceTime and your Zoom videos. When doing these things, just keep in mind, choose a clean and simple background free of distractions. You want to make sure if you're doing it from home that the kids aren't running around in the background, the dogs aren't running around, that you have a simple, fresh background. Make sure your lights are also favorable. Do not sit in front of the window or blinds. Adjust your lamps and just check to make sure lighting's good. Also, when you're doing the lighting and all that, a great way to do it is just test your system. Make sure your sounds and your videos and everything are going well. And also dress for success. Wear your park logo, polo. Try not to look like you just came from the gym or just waking up. And also, practice makes perfect. Practice with your staff, at your park, other managers and supervisors, to really make sure everything that you're doing is well and you're not having any sort of technical difficulties with video or sound systems, and everyone can hear and is clear. And also, when you're done doing these, make sure you're enthusiastic about what you're doing. No one wants to sit through a boring interview. Add some jokes. Just be enthusiastic about what you're doing. Wes, you want to go to the next one? So, conducting lifeguard training. Online learning in our module is a lifeguard portable. If you haven't explored it yet, it's a good time to do so. We've done a lot of upgrades to it. We've made it much more interactive, and it allows for greater knowledge and retention, and with restructured content. So if you haven't taken a look, we've added the Elite Dispatch program, online self-study. We've done the lifeguard blended learning. Once you completed those things, you can take advantage of the virtual trainings that we've also created that are located in the portal as well. A little bit more about the virtual trainings. Once you completed the blended learning, you can use our virtual training. It's 3 block plans that you can discuss and go through with your staff. It takes about 6 to 8 hours to do this training. Set it up in different ways. You can do it all through as once, but I always find that it's great to break it down into three days and make it a lot easier with your staff to retain. Once you get into, you've done your virtual training, you've done your online training, what are we going to do when we get ready to do our class? So really what we want to talk about doing is developing a plan for screening. Are we going to do temperature checks before the staff gets there? You wanted to, at least 72 hours prior to the course, notify each student to make sure that they don't have any of the symptoms, that they are, no temperature, shortness of breath, muscle pain, any of those sort of things. And if they do, strongly make sure they stay home, recommend that they stay home. Making sure that we have ensured proper PPE is available. Make sure each student has a hip pack, CPR mask, and face cloth for covering. And try to do the best you can with disinfectant, making sure your equipment before is clean, and after the course, make sure you're cleaning your equipment as well. Proper supplies of gloves, sanitization, doing these things to make sure that everyone's clean, and also just doing the best you can for social distancing. Wes, the next one. So additional training and best practices. When you're conducting your classes, if you've done the virtual training and now you are doing your one-day classes, if you have large classes, make sure that this is a great time to utilize your veteran staff to assist with this class. Instead of having the instructors teach everything, utilize your veteran staff to lead groups and do small discussions and trainings, but making sure that the main instructors are the ones that sign everybody off. Set up your class to maximize the efficiency and time of equipment. If you have certain groups going on, you can set up spinal management going on in one section and then maybe have CPR going on in another area. And also another good way is to do your prerequisites this way. Set up your swim area, set up a tread, have these different sections going so you can help save time. Encourage frequent hand washing. Whenever you can, make sure that you're taking breaks and having your staff clean and wash their hands before they move forward. And also, before you start your class, make sure that your lifeguards understand that, we really want to follow social distancing as much as possible, but making sure that everyone understands that not everything can be social distance. Our rescues won't be social distancing. Our pit crew training, CPR won't be social distancing, but really trying to make sure that everyone's safe while doing these things. Face coverings, if you're having sessions going on, face coverings will be worn during discussion times. If you're training in the water, lifeguards, if they're putting their face in the water, masks, you won't need any of your masks. Gloves must be worn when sharing equipment. If you're using backboards, if you've extricated somebody, if you're using BVMs, making sure that your staff is sharing gloves or having their own set of gloves, and not everyone's touching all the equipment, but just being safe and sanitizing.
Cool. All right. Thank you, Joel. And I'm going to move forward here. One more, just to be able to access this information. For anyone who doesn't have our information, info@starguardelite.com. We are very responsive to that email on our Facebook page. The QR code's there. You're obviously on it if you're watching this video live right now, so that's great. But we will continue to have more information. This presentation will be posted. So what I'm going to do is we're going to bring everybody back on, and we're going to answer some of the questions that have come about. So bear with me here while and what's happening is my mouse disappears from my computer, and I'm on this app, so it's making it a little bit tricky to bring everybody on. But all right, so we've got Justin, Jill, Joel, and myself. Does Justin or Jill, have there been any questions that you've seen that you want to address at this point?
Yeah. So Craig Sears had made the comment about the new CDC guidelines having something I mentioned about having equipment stay in the pool to be disinfected, as opposed to the CDC guidelines saying you should still disinfect it separately. And the clarification on that is during lessons, keep that equipment in the pool as you're using it. And a lot depends on the type of equipment you're doing too. The things that are long-term, high touch that you're using over and over again, all of those things like your kickboards and some of your bigger equipment definitely needs to be disinfected separately. Some of the little things that are in the pool that are just used frequently throughout the lesson, keep those in the pool close rather than putting them up on the side and then bringing them back into the water. I just wanted to clarify that.
For sure.
Yeah. And then, so the couple that I've seen are, should we be using BVMs on everybody? And that's something that I've long hoped for in the industry, independent of COVID. There are some practical considerations. As somebody pointed out, you're not going to have the BVM on your hip pack. And it might be that you're starting rescue breathing in the water with a mechanical type filter. such as the Seal Easy or Big Easy, and then transitioning to that paper bacterial viral filter once you get up on the pool deck, and then integrating the BVM as soon as practical. But it's not practical necessarily in this industry to always start with the BVM, because the flip side is doing nothing until that BVM arrives, instead of something that you can with mouth to mask. And then the question of the face coverings, and unequivocally, my face mask, I call them all face masks, I apologize. The cloth face covering, mine protects you and yours protects me. So the lifeguard that's wearing it in the stand is not wearing it for his or her own protection. They are wearing it to keep from spreading if they are in that asymptomatic phase. And even being in an elevated position, as I exhale from that elevated position, it's falling and dispersing over a greater area than if I was just standing on the ground. So our recommendation is for lifeguards to wear cloth face coverings. And again, as with all of this, you'll find what works for you practically in your specific facility. And then to the question of the temperatures and taking temperatures, we are not advocating for taking temperatures during rescues, during resuscitations, or while treating patrons. It is for screening for employees or patrons before they enter the facility. And the temperature checks don't give a lot of good information. If we're using the contactless ones, they're not as good. They can be affected by being out in the sun, by the person being hot, from exerting themselves across the parking lot and such, and may give false readings and may create more confusion than they solve. Additionally, in some jurisdictions, it's a medical exam that has to be performed by a qualified medical provider. And because you're performing a medical exam, you have to document it, which then those medical records are now health records that have to be protected again according to HIPAA. And so it may only be human resources or a medical provider that can perform that temperature check. So if you're meeting those logistical challenges, then it's not worth the struggle to get that additional bit of information that may or may not be reliable. And so if you decide temperature checks work for you within your regulatory framework, great. If not, then it's not something that I would push for and fight for.
Cool. Thank you. And Jenny from City of Indianapolis asked about having a designated COVID point of contact. Is that person present on site at all times? I would say this is the same as an emergency action plan in general, in terms of if there's an emergency, there's always going to be a point person who is pulling the trigger in terms of saying who's doing what and coordinating that. However, that overall, for a large organization, they have the ability to contact someone who would then be that point person for the entire organization. So it's a bit of a combo in that sense, but there needs to be somebody on the facility at the site that understands and knows what to do in those early moments, just like you would with an emergency action plan.
And then to the question on the CDC and the contact rescues, I don't have the ability to type into the chat. Wes, can you put up the QR code with the CDC aquatic guidelines on there, and then just search for the word gatherings. It's right under the designated COVID-19 point of contact. So when you go to it, just search for gatherings.
Yep, and it's posted. And again, this presentation will be available. I know that someone else asked for a link that was shared earlier. Again, this presentation will be available so that you can access all of this after the fact. Just stay in touch with our Facebook page and you'll find it there. Is there any other questions that you guys have seen that anyone wants to tackle at this point?
So it seems, again, I always enjoy working with Craig in Atlanta. He always has good insight and good questions. And it seems to be a lot of questions about who should that point of contact be. And there's no answer that's going to fit every situation. The intent, I think, would be that you want to stem the spread of misinformation at your facility, both among patrons and staff. And you want to have somebody with whom the buck can stop, that is well informed and not spreading conspiracy theories and diminishing the seriousness. And so that might be a medically trained person, that might be a managerial person, that might be somebody on the HOA board of directors, or it might be an outside consultant that is hired. And I think that as long as that is the person where the buck stops, where everybody knows that they can go to get reliable information, that their level of medical training is not as important.
Cool.
I'd like to add one more thing about the logistics of when you start to open up and kind of grow your swim lesson program. If you have a large staff, you might want to consider dividing up your staff into teams so that if one person on that staff becomes exposed, has to self-quarantine, or you need to limit them coming back to work, you're not keeping all of your instructors together all the time, because then if one is exposed, then you have no staff. So you might want to consider dividing up into teams to manage that particular circumstance.
Thank you, Jill. And we understand some facilities. So we have some pool management companies that have hundreds of pools spread across a large geographic region. And that might be a situation where they can isolate staff to certain facilities. Others are all, might have a large staff that's at one facility. And then in that situation, they may be able to run teams. We know that most facilities, most everything is operating kind of on a limited capacity or a limited operation. Nobody's running full speed per se for the most part. So that might be something that's feasible. We know that for some facilities, it's simply not, but it is a great recommendation if it's something that you can incorporate within your daily operation.
And then Kathleen's comment, I read that too and kind of shook my head and was like, holy smokes, how are you going to do that? And that's, what is your recommendation for out-of-state visitors or visitors from high-risk areas? CDC states operators may consider, quote, limiting aquatic venue use only to staff, patrons, and swimmers who live in the local area if feasible to maintain healthy operations. If we as a non-essential recreational industry have decided to open, and we are now have a duty to act and a duty to become essential healthcare providers, that if we are walking that razor's edge so close that we are having to screen to say you can't come in from this certain hot spot today, then I think we may have opened too early. And I think that we may be already too expanded within that. And if you look at the White House Opening America Again guidelines, it talks about that tiered level of business and leisure travel as well. And ideally right now, nobody is doing specific leisure travel. And I think that a diplomatic way to do that, if you are reopening, is, if you put up a sign that says locals only, that there'll be outcry. But if it's if you live in these zip codes, you get a discount for coming in to encourage people within our community. But yeah, that statement was a head scratcher for me too, Kathleen.
In regards to the question about cloth versus neoprene mask, it's your preference. Personally, I like the cloth gaiter style. But however, I know I have friends and family that they prefer the neoprene style. I have one from Original Waterman and one from Water Safety Products, and I wear them both, and they're great. But that's really more of a personal preference. Justin, I know we've talked about this at length, but the idea is that cloth mask is cutting down the aerosols, particularly the large droplets, and they both accomplish that, if you will.
Yeah, and I would just clarify that those are Lycra and not neoprene. I don't think anybody can breathe through a wet suit.
Yeah, good point. Good. Okay. Heather asked the question, pit crew CPR multiple guards on one mannequin or separate mannequins operating as if on one mannequin. And our response to that has been that if you can do it, the latter, that's great. But that for a lot of facilities, it's simply not feasible due to a lack of either equipment or a lack of training space or just overall resources in general. And if you're in those situations, everyone should be wearing a face covering and wearing gloves so that they're not, there's not any contact between common touch points, but that is an unavoidable moment of training that is critical to the overall objectives. So that's one of those that it's on a case-by-case basis. A lot of other, some general feedback here. Joel, Jill, Justin, I don't know if you have any other comments or anything you wanted to share before we start wrapping up here.
Yeah, nothing else was jumping out at me other than to just say that, these are unprecedented times, and we have evolved very quickly as an industry in just 10 short weeks. That number just keeps sticking with me because, man, I really do feel like we've been doing this for years. And it's going to continue to evolve. But the overall message is still the same, and that is risk management and risk mitigation. And how do we keep that risk to an acceptable level? And that's going to look like now fewer people in the facility, fewer people in specific areas, enhanced cleaning, use of cloth face coverings, and slight modifications to the rescue protocols that we should hopefully not have to use, because we are going to be so vigilant with our prevention. And those themes are going to be the same whether there's a new local or regional outbreak or not. We're going to assess that risk and determine, is the risk of opening worth it right now?
In regards to where to source N95s and these types of masks, really it's a common challenge working through a variety of suppliers. Jeff, I would recommend you speak with do the research for the guidance for the other acceptable mask at this point, and then take that expanded list instead of looking for strictly N95s. Justin, I don't know if you know of any suppliers or anywhere that they could reference, but
and I don't on the N95s. I do want to go back to the cloth face masks. Kind of was seeing some of those comments on not using bandanas and scarves because they don't offer as much protection. The cloth face covering doesn't offer me any protection at all. It offers me zero protection. It is, if you've ever stood outside on a cold day and you can see your breath, it's to keep that breath from traveling. And so if it's overly thick and I can't breathe through it, I'm not going to want to wear it. If it's sheer lace, it's not going to block a lot of my exhale. And so we're looking for something in between. And so some of the Lycra materials may not filter out as much as a thick double layered cotton. And that's okay. As the point is that we are using something to try and reduce that risk, but it's not intended to block out 100%, or like an N95, 95% of what I'm breathing in, or an N100, near 100% of what I'm breathing in of a certain particle size. It's meant to just be kind of a general, this is going to reduce by some percentage. Maybe it's only 25%, maybe it's up to 75%, depending on the material of what I'm breathing out. And if everybody does that, then there's a lot less hot breath hovering in the air at any given time.
Yes, agreed. Joel, do you have any closing comments or thing you want to add?
No, I think it's just important to have a plan with your training, using the virtual training, using the information that we have on the portal, and being ready, hopefully, to reopen instead of just kind of waiting around and hoping things are happening. Try to stay on top of everything. You're hiring, getting your supplies, your PPE supplies for classes, and making sure that you have a good plan moving forward. So when you're ready to train, you can get right into it.
Yeah, we had a client in Southern California that is planning on reopening and was given somewhere in the neighborhood of 4 to 7 days to say, okay, we're going to open in 4 to 7 days. And at that point, very little training, very little anything had happened. And we know the amount of time that's necessary. And when the when the green light is given, it's going to be a very small window. So absolutely utilizing whatever resources and doing whatever you can ahead of time to cut down on that, because there's a lot of tools that are out there, but there's a lot that can be done ahead of time, and we really can't stress enough the importance of that. Jill, do you have any comments that you wanted to add?
Yeah, just putting on the creativity hat and creating experiences that people can come, because we know swim lessons save lives. To have that availability is critical during this time, but it has to be done in a different way. So come up with something that can be of value to the people that you can bring into your facility, at the same time reducing that risk.
Absolutely. And Justin, do you have any closing comments or questions you want to answer? No.
No, that's it. Again, I greatly appreciate all of the participants. There's a lot of great discussion in there just amongst participants on sourcing materials. And I think that this has been a beneficial forum, and I greatly appreciate you all.
Great. And I'd like to close just by reemphasizing the importance that we have the opportunity as an industry to provide a recreational experience and a recreational outlet for our patrons, our communities, and provide something, an environment that we know the virus does not survive very well in chlorinated or outdoor environments. UV and chlorine are very good at inactivating the virus. We can come up with solutions. We can pull this off in terms of giving safe experiences, and both to our patrons and our staff. And it's, again, like to Jill's point, put on our creativity hat. Let's think outside of the box, and we can make this happen. So let's continue to push forward. We will have further updates as we feel necessary. Thank you guys so much for today. I'm going to take everyone off the screen. I'll leave our contact details. We would love to talk with you if you have any further questions, and just please let us know. And we look forward to speaking with you further in the coming weeks. Everyone have a safe week and a safe summer.
All right. Thank you all.